We want to get out of our comfort zone and then go beyond exchanging among scientists and really share the evidence with relevant stakeholders, including a government representative, on what were the ABCs of this epidemic, which is also hitting Europe. Sedentary lifestyle, poor nutritional habit, leading to this epidemic of a specific form of obesity, abdominal obesity, which is really a very powerful risk factor for type 2 diabetes. We presented evidence that if you want to assess the risk associated with obesity, you have to go beyond measuring weight and height and measure waist circumference as a vital sign. So we showed evidence today that for a given body mass index, for a given amount of total body fat, those individuals with an enlarged waistline who had greater risk of having too much fat in their abdominal cavity, a condition that we call visceral obesity. They would have too much liver fat, too much heart fat, so they would have too much fat in their lean tissue. And we call this condition ectopic fat deposition. And this caused really prejudice to the health of afflicted individuals. We need to link this condition, abdominal obesity, to poor nutritional habit and poor drinking habits, as well as to a sedentary lifestyle. So we really need to raise the awareness of physicians managing those patients, as well as the population. And then obviously we need to think about, okay, what do we do in clinical practice and what do we do in terms of public health to both manage properly, optimally, and prevent this condition.
I think there is no doubt that health is one of the most important issues for European citizens. As a matter of fact, a recent study has shown that it is number 2 on the priorities of the European citizens after education. For the life of the citizens, because we have so many deaths because of obesity and lack of physical activity, but also for economic reasons, because certainly people who are obese, they get sick very often, they don't go to work, and therefore employers and the state loses from lack of productivity. We decided to proceed to a further step and adopted recently in the European Commission, which will propose to the European Council, to the Council of Ministers, a council recommendation on physical activity in the member states. The second thing that we propose to do is to establish, as from next year, a week of sport, so that we get all the stakeholders together: education ministries, health ministries, stakeholders, the sport industry, the local authorities, to work all together in order to mobilize all the citizens during that particular week, in order to raise awareness about the usefulness of physical activity and to encourage everybody to get out of their couch and do some exercise.